welcome. Thank you for watching this video. This is Nurse Shoma, your NCLEX Prep Coach. And today I'm going to be talking to you about why you're not retaining what you're studying. So if this is your first time watching any of my videos, thank you so much for watching. I'm Nurse Shoma, and pretty much what I do is I help test takers such as yourself to pass their NCLEX exam, whether it's your RN exam or it's your LPN exam. And this is something that I am definitely passionate about doing, and just really helping those of you who have been in positions, especially those who have tried to take the exam and have not been able to pass their exam. And so I'm really especially passionate about repeat test takers, also first-time test takers as well, but I'm very committed to pretty much helping you to pass your exam. So let's go ahead and go into this topic today, and this won't be as a really long video today. So I'm going to talk about why you're not retaining what you're studying. I don't know if any of you can relate to that statement already. And one of the things that I've noticed for a lot of people, that I've talked to on the phone, just from listening to a lot of things that a lot of people have told me, is I've heard a lot, I'm not remembering what I'm studying. Like I'm reading the books, or I'm watching the videos, or I went through the reviews, but it's like it's not clicking. Like I'm not retaining it, and I'm not sure why. I don't know if you can identify with that statement right there. You're going through that right now. That's one of the common things a lot of people say, is that I'm not really retaining what I'm studying. It's not really sticking, even though I am putting the energy towards it. So here's the thing, like either I hear people say like I'm not retaining what I'm studying, or they'll say I'm not retaining the content, right? That's usually the statement. I'm not retaining the content. And usually when content is translated, in my opinion, I mean it's a lot of different things, but the most biggest thing is that it's translated to diseases. So a lot of times when people say, I'm not remembering the diseases, or I'm not remembering the medications and that kind of stuff. But that's one of the common things. The biggest thing out here is like, I'm not remembering the diseases. Like that's not sticking with me. So here is what I found, okay? This is the reason why. I want you guys to really, and you want to write this down too. This might give you some, hopefully some insight and some clarity. The reason why, and what I'll say too, it's not for everybody. Everybody is different. Like some people, they do retain the material even with the books and with the reviews and with the videos and everything, but some people don't. And I'm going to talk about why that reason is. So you ready? Hopefully you're ready for this, okay? The reason why, right? The reason why many test takers will, read from the books or do the reviews, and you're trying to learn all the diseases. The reason why you're not remembering it is because you probably have a weak understanding in the pathophysiology. Let me say that one more time. One of the common reasons why people struggle with remembering a lot of the disease processes is because you have a poor understanding of the patho of the body. Here's one of the things I always tell people. It's going to be very hard. It's really hard to learn something, the abnormal of something, if you never really got the normal. Let me say it one more time. It's really hard to understand and comprehend and remember something that's abnormal if you didn't really learn what's normal. Think about, for example, somebody that's a mother, and you have a child. And let's say, you notice that the behavior of your child is off. And so you take your child to the doctor, and the doctor says like, oh no, they're fine. But you tell them, no, I know how my child normally acts. So this is not normal for them. There's something wrong. And the reason why the mother can determine that and see that is because they know how the child is normally. So one of the issues that a lot of people have, the reason why you can't remember heart failure and COPD and all these disease processes, is because you don't have a very good grasp of how the body is supposed to work. And I don't mean just basics. I mean like you really understand in detail how blood flows. You really understand in detail, how the brain works. You understand what the parietal lobe is, the frontal lobe works. Like not basic stuff that the average person would know, but stuff that the nurse would know. This is one of the areas a lot of people kind of overlook and forget about. And especially as an international test taker, there's not really as much of an emphasis on this as well, which is another reason why international test takers have a challenge in passing the exam. So the path, though, is very, very critical. Okay, I'm going to give you an example so you can see the difference. Okay, so what I'm going to do, I'm going to give you a really good example so you can see what I mean by this, like why you need to really understand how the body really works in order for you to remember the disease processes. Okay, so let me give you an example of Cushing's disease. I talked about Cushing's disease recently, but I like Cushing's disease though. So I'm gonna give you, let's say for example you had a book in front of you and you were reading Cushing's, or maybe you were listening to a video about Cushing's disease, like either one. Here is what you would probably hear. All right, listen to this whole thing. Listen to this very closely. Cushing's disease is the cause of Cushing syndrome, characterized by increased secretion of adrenal corticotropic hormone, which is ACTH, from the anterior pituitary. This is most often as a result of a pituitary adenoma or due to excess production of hypothalamus CRH. That stimulates the synthesis of cortisol by the adrenal glands. Pituitary adenomas are responsible for 80% of endogenous Cushing syndrome. When excluding Cushing syndrome from exogenously administered corticosteroids, this should not be confused with ectopic Cushing syndrome or exogenous steroid use. The common signs and symptoms of Cushing disease include weight gain, high blood pressure, poor short-term memory, irritability, excess hair growth, impaired immunological function, red face, excess fat around the neck, moon face, fatigue, and red stretch marks. Diagnosis is made by first diagnosing Cushing syndrome, which can be difficult to do clinically since the most characteristic symptoms only occur in a minority of patients. Okay, so that is what you would typically read, right? Like what I just said right now, everything I just said right now, that's what you would typically read in like a book, where I just defined it, I gave you the symptoms and I gave you a whole bunch of like words. Let me ask you right now, be totally 100 and put in the chat box. If you read that and then plus also studying other diseases, do you think you remember that? Everything I just verbally said it too. If you read that, like that's the language that they put in the books or in the reviews, and they talk like that, like let me just put in the chat box, be honest. Do you think you would remember that? Like you're reading that over and over again, and you're reading those symptoms over and over again, and you're reading that definition over and over again. Do you think you remember that? I don't know about you, but I wouldn't. I'm like, what? The exogenous what? Adenoma what? ACTH what? Like that's how I would respond. I would have kept on reading it over and over and over and over again, but I wouldn't retain it. And that's the language that a lot of the books use, and that's pretty much how they explain everything, like in that type of language. And then they just go into a lot of detail about the disease process. I wouldn't remember that, especially, and then plus you're also studying other diseases too. All right. So that's the first example of you learning, the actual disease. That's probably what a lot of you are doing right now. You're reading the books from, with that type of language, and you're wondering why it's not retaining. Okay. Now, let me give you the difference. Okay? So get ready for this aha moment, okay? Let me show you the difference if you had learned the patho first of the body in layman's terms, okay? Let me show you the difference. If you had learned the pathophysiology, and patho pretty much means like how the body works. That's what it means, okay? How the brain works, how we talk, that kind of stuff. Okay, so if you had learned the patho first, here's what it would sound like. Okay, so we have adrenal glands, right? And we have these adrenal glands that's located on top of our kidneys, right? So obviously we have two kidneys, so there's two adrenal glands. Okay, so adrenal glands, they release a hormone. Okay, they release a hormone called cortisol. So what does cortisol do? Well, cortisol is a stress hormone, meaning that whenever the body goes into stress, you go into that fight or flight. You heard that before, that fight or flight mode, where your heart rate goes up, that kind of stuff. So cortisol is responsible for, it causes the blood pressure to go up. It causes the arteries, to be more bounding. It increases the blood pressure, increases the heart rate. That's why it's not healthy to be stressed, right? It's not healthy to be stressed, because then your blood pressure will go up and your heart rate will go up, right? So pretty much what Cushing's disease is, so I just explained the patho first. So pretty much what Cushing's disease is when the body releases a lot of cortisol, like too much cortisol. And the reason why it's releasing so much of the cortisol is because the adrenal gland, right, because that's where the cortisols are released from, there's a tumor on the adrenal gland. And that tumor is causing it to mutate and start releasing too much of the cortisol. And that's why they have Cushing's. So because I understand what cortisol does, and now they have too much of it, no wonder the blood pressure, I would expect the symptoms would be the blood pressure will go up. Oh yeah, their weight's gonna go up, their heart rate's gonna go up, like everything pretty much goes up because of the cortisol. Their weight goes up, their GI motility goes up, so that's why they're having diarrhea. Their glucose goes up. That's why their sugar levels go up. Everything goes up. That's Cushing's. Now, I just explained that right there. Let me ask you, between the first example and this one I just gave you right now, which one are you more likely to remember? All right, the first one where I was reading it, right, and I was like reading the definition. I was telling you the disease with exogenous, all that kind of stuff, and I talked about the symptoms. Or this one I just said right now, where I explained the patho of the adrenal gland, and then I transitioned it into Cushing disease. Which one are you more likely to remember? Which one? The second one or the first one? The second one, right? Exactly. Because why? It's like, it just like, oh, naturally, oh yeah, duh. Like, if the adrenal gland is all messed up and that's where cortisol is, no wonder it's so bad with Cushing's. Like, you're more likely to retain that. It's just become so natural. But I know how it is. A lot of you, the way you've been studying, everything is just so like complicated, and it's just like, and they're using this language that's so, what's the word I'm looking for? Like, the language is just too difficult. Really, that's what it really is, and then plus, look, not only are you aware of what causes it, now you understand the tumor situation. So obviously the way I would treat it is to get rid of the tumor, right? Like so they're probably going to need surgery. So that's treatment. See how simple that is? Oh my gosh, so simple. And then when you think about, okay, the opposite of Cushing's is Addison's disease. So with Addison's now, instead, there's too little of the cortisol. So because there's too little of the cortisol, everything goes down now with Addison's. So now the blood pressure goes down, their weight goes down, the GI motility is slow, so that's why they're going to be more constipated. The glucose goes down, everything goes down. The only thing that's elevated, though, because I know this, the only thing that's elevated with Addison's is the potassium. So they have hyperkalemia, but everything else goes down. See what I just did right now? In just 5 minutes, I told you everything I just told you right now. I told you what the adrenal gland does. I talked about cortisol. I talked about 2 disease processes, Cushing's and Addison's, and that also gave you the symptoms, and that also gave you the treatment, which is now obvious because you understand how it works in the body. Super easy. Super easy, right? It just becomes more natural. I'm telling you. It just, like, this is why it makes it significant. It's really significant when you learn the patho first. You're more likely to remember it. But if you learn the disease first and you don't really understand how the body normally works, you're not going to remember it. You're less likely to remember it. You know, just like when you think of like heart failure, you know, heart failure, if you understand how the heart normally works and you understand how blood normally flows, heart failure is easy. It becomes easy. I'm telling you guys, the way you've been learning it is hard. Learn the patho first. Okay? Learn the patho first. You learn the patho first, it becomes more natural and it becomes more obvious. Right? It really honestly does. Okay? So the main point that I wanted to give to you today, I just wanted to help you to really grasp, you know, how significant it is to understand the patho. And that's why a lot of people don't remember the diseases, you know, when they take the exam or when they look at the questions. Like, it's hard to know the answer to a question that you don't really understand the content of. You know, like it's going to be challenging to recall it. So that's why, you know, I break it down really simple. Right? A lot more simple. And that's why you want to understand the patho first. It makes a huge difference. So if you've been struggling to retain the diseases, then I would encourage you, you'd probably need to go back and look and learn, you know, the body, you know, learn how the brain works, learn how the heart works, you know, learn how the stomach works. Then all the diseases become more natural. Okay? All right, so I hope that you found this. Like I said, I was going to keep it really short today. Hope you found this helpful. Hope you found this enlightening and that you saw a bigger, like, let me know, please. I want to hear that you saw a bigger picture, that you saw the difference, and you see how it becomes more simplified and much more easier when you learn it in this way than the other, right? So you're welcome. So if you thought this helpful, definitely, like I said, share this video as well. And like I said, a quick recap pretty much is that the reason why people are not retaining, you know, especially the disease process, is because you're not learning the basics first, which is the patho.